It's called Diastasis recti. That's when the stomach muscles separate because of organs pushing against them. On today's edition of Today's Health, we learned that it happens to women during pregnancy, but the problem is the gap doesn't close for everyone after. Christy Lee has the story.
Kimberly Emmerling is in the best shape of her life, but for years, her stomach didn't match the rest of her body.
I looked like I was 9 months pregnant.
Even though she was doing CrossFit 5 to 6 days a week.
All the crunches, planks, anything that was thrown my way, I was trying to flatten my stomach.
Turns out those were all the wrong exercises because she had diastasis recti. DR is when the muscles on either side of your stomach part because of organs pushing against the connective tissue that holds them together.
That layer is what keeps the insides in and everything else out, and that's also what makes the abdomen look flat.
Dr. Daniela Carusi of Brigham and Women's Hospital says it happens to almost all women during pregnancy, but
about 30 to 40% of women may permanently have some separation there after a pregnancy.
DR can cause low back pain, urinary incontinence, and constipation. But for most, it's just cosmetic, and surgery can fix it.
Hey, how are you? Good. How are you? Good.
But Kim didn't want to go under the knife, and in February found Caroline Johnson.
It offers people a way to heal a diastasis recti non-surgically.
Johnson teaches the Tupler technique, one of several programs developed by DR experts. It involves wearing a splint 24/7.
The purpose of the splint is to reposition the muscles back to where they should be. And then exhale back to fifth.
And breathing and abdominal muscle exercises for 6 to 18 weeks, depending on the size of the diastasis. For Kim, it was 15 weeks. If you think you have DR, here's how to check.
You'd have your fingers pointing down towards your pelvis. Okay, you're going to bring your fingers in and then lift your head up slightly and then lower it down.
With DR, there is a gap between the muscles at least 2 to 3 fingers wide. Kim's was severe at 6 fingers.
In terms of everything, it's just given me more confidence, it's given me a happier body image, and I feel good. It's an actual physical good feeling.
In other health news this morning, regular exercise can help prevent depression. A new study found just 1 or 2 hours of exercise a week decreased an adult's risk of depression by 44%. These mental health benefits were seen in men and women of all ages. Experts say the physical and social aspects of exercise may protect against depression. Physical activity did not help prevent anxiety. And more evidence today that breakfast really is the most important meal of the day. A new study suggests skipping a morning meal may increase the risk of heart disease. Data from over 4,000 adults show breakfast skippers were more likely to have atherosclerosis or hardening of the arteries. Even those who ate a low-calorie breakfast were at risk. People who skipped breakfast were also more likely to be obese and have an unhealthy lifestyle. That's it for this week's edition of Today's Health, and coming up on KPVI News Today, we take a look at your KPVI News Today headlines.